Well, this is a pelvic ultrasound study of 21 years old female, unmarried. Here I'm going to show you the longitudinal section of the uterus to start with. Now this is the uterus, my 4.9 by 2.7 centimeters. And second thing is that the endometrial canal shows fine echoes within it. Now this is the, actually I'm going to take the length again, 6.6 by 3.3 centimeters. This is the longitudinal section of the uterus. This is the anterior myometrium, this is the posterior myometrium, and this is the endometrial canal, this area which I am going to encircle now. And you will see that there are echoes within it, fine echoes within it. This is the cervix, the vagina. This is how you align the uterus with vagina to get the proper length. And now I am getting the proper length of the uterus in longitudinal section. Now the endometrial canal, though not dilated, does have echoes within it that are suggestive of bleed. And in a non-dilated non-dilated endometrial canal, it measures 12.8 and is in late secretory phase. So now when I go to the transverse section, this is the cervix. Now this is the cervix, cervical canal, and I move the probe bit towards the right side. I see echo-filled area, cystic area, giving posterior wall enhancement. This is the cystic area. Tubular cystic area measuring approximately 7.3 into 3.6 centimeter. This is the tubular cystic area, this area, and this is the urinary bladder, this area in longitudinal section. And you can see there are echoes. These are all echoes, different strength echoes scattered throughout this cystic area. In the region of the right adnexa. Okay. Now let's see the scenario on the left side. It starts. This is the uterus. This is the uterus. And here, the start. Now you see there are septas. This is a septa, this is a septa, this is a septa. It is septated as well. And these are the echogenic areas within the cystic area. Now when I go to the left side, there is even larger cyst in the region of the left adnexa. And this is the uterus. This is the uterus, this area in transverse section. This is the urinary bladder, and this is the cystic area. This one measures approximately 10 centimeter by 4 centimeter approximately, and who has echogenic areas within it. Is tubular, and this is the region of left adnexa. So something to show you about this cystic area is that it is filled with echoes. I'm magnifying it to show you the echoes within this cystic area. In transfer section, now I'm showing you in transfer section, you can see that there is thick debris seen settled down with the posterior wall. This is the posterior wall of the cyst. This is the cyst. This is the posterior wall. The anterior posterior diameter. The size is 7.8 into 5. I will say 8 into 5 centimeters, and you can see the posterior wall enhancement. This is the fluid part, clear fluid, and this is the fluid wet echoes, and these are thick echoes within it, within this left adnexal cystic mass. Cyst in the region of the left adnexa. And however, so far no calcification is seen. Both these cysts do show posterior wall enhancement or strong back wall, as we name it in our terminology of ultrasound. You see the posterior wall enhancement. This is the strong back wall or posterior wall enhancement. Tiny calcification is seen. This is the tiny calcification giving shadow, and you can see the debris or echoes filled within it, throughout it. This is all debris, and its wall is thick. See the wall. This is the wall. This is the urinary bladder, and this is the left tubo-ovarian cystic mass. So this is a case of, in fact, bilateral tubo-ovarian pathology, tubo-ovarian cystic mass, which is consistent with bioserpings, bilateral bioserpings. As you will see, there is debris also seen within this right-sided, cyst. This is the right adnexal cyst. This is the right adnexal cyst, and this is also a cystic area. These are the septas. These thin lines, linear structures are the septas, and there are thick septa. This is thick septa, and there are thin septa as well. This is a thin septa. Now this, here you see there are debris. This is all filled with internal echoes. So internal echoes are present. This is the cervix. This is the urinary bladder. So this is a case of bilateral bioserpings in a 21 years old female with rest of the ultrasound shows normalcy. What important is to see if there is any paraiotic plan lymph node enlargement. If it is a cold, it's a cold nature, which is common in our area. Spleen is not enlarged, no pleural spleen, kidneys are normal. So, is there any regional adenopathy? Should also be seen. Now these are the iliac vessels on the left side. So we don't see any lymphadenopathy in this region, nor high lymph nodes in this region. Iliac vessels on the left side, now on the right side. There's some gel, short of gel. Okay, now these are the ideal vessels. No original adenopathy is seen indeed. So this is a case of bilateral tubo-ovarian complicated cystic mass, most probably bilateral biosalpinx. Further investigations are required, and this is our case of the day. Thank you very much.